Hi all, I'm Dr. Malati working as a professor in Triplam College of Nursing. In this video, I'm going to discuss about the antenatal assessment. It is going to be a demonstration procedure for BSc nursing students, post-basic and for MSc nursing students. Objectives are definition, importance of AN assessment, pre-preparation, procedure, summary and conclusion. Introduction. Antenatal women refers to pregnant individuals receiving medical care and support from conception to birth, focusing on ensuring the health and well-being of the both mother and fetus. AN assessment is crucial for ensuring the health and well-being of both the mother and fetus, can able to prevent the complications and promote the positive pregnant outcomes. Definition. It is a systematic examination of a woman during pregnancy called as AN assessment. Importance of an AN assessment: to detect the deviation from the normal, to detect high risk pregnancy and provide special attention, to assess the fetal size and growth, can able to locate the fetal parts to indicate the position and presentation, auscultate the fetal heart sound, and we can able to reduce the fetal and maternal morbidity and mortality. Preparation. There are two types of preparation is there, environmental preparation and patient preparation. Under environmental preparation, we have to maintain a proper privacy, maintain an adequate ventilation, maintain adequate lighting and keep the surrounding clean. Coming on to the patient preparation, make her comfortable, ask the mother to empty the bladder, take a consent from the mother, position her properly. Articles needed for antenatal assessment are weighing scale, clean tray, which is nothing but a vital signs tray. It should contain thermometer 1, stethoscope and sphygmomanometer, drape sheet, inch tape 2 numbers, torch and fetoscope. Procedure. So we can able to identify the high risk pregnancy through the antenatal examination. So before we start our abdominal examination, we should collect the history from the mother and head to foot examination followed by abdominal examination. First is history collection. History collection contains baseline data like name, age, education, occupation, religion and socioeconomic status of the mother. And coming on to the obstetrical history includes LMP, which is nothing but last menstrual period, expected date of delivery and period of gestation, previous birth history. If a mother is a multigravida, you should collect the previous birth history, like whether the mother have developed any complications during first trimester, second trimester and in the third trimester, or else during AN period, intranatal and postnatal period. So we can able to calculate the EDD with the help of last menstrual. If a mother knows her LMP means first day of last menstrual period, that is 9 months plus 7 days. If you are calculating, we will get a expected date of delivery. Few mothers, they don't know the last menstrual history, means last menstrual periods. In such situations, we can able to calculate the EDD with the help of a USG, ultrasonography, based on the fetal growth and development. Then you should collect the history regarding the chief complaints and present medical and surgical history. Present obstetrical history. Under the present obstetrical history, duration of marriage, consanguinity, obstetrical score, which is nothing but gravida, parity, living children and abortion. So apart from these four things, stillbirth, ectopic pregnancy and MTP also to be collected. Then type of conception, whether it is spontaneous or induced. Then antenatal checkup, whether it is regular or irregular. History of hyperemesis in the first trimester or else in the previous pregnancy. UTI, bleeding or any minor discomforts, immunization regarding the injection TT2 doses, USG scanning whether she has done in the first trimester as well as in the second trimester, and other blood investigations. So detailed information of present obstetrical history we have to collect it. Then coming on to the menstrual history, under the menstrual history you should ask the mother regarding when she has attained the menarche, whether her cycle is regular, how many days once she will get her cycle, what is the duration of the menstrual cycle, and about the blood loss during the menstruation. Then you should collect the history regarding the past medical and surgical history, as well as mother, whether she is having any drug allergy. General examination. So general examination, it is like other head to foot assessment only, but mainly we have to focus here on the obstetrical aspect. So general condition, build and nourishment of the mother, we have to check the height and weight, and also the vital signs. Inspection, the skin color, texture, warmthness, moisture, and any lesions. Head size and shape, hair color, texture, infestation in the scalp. Then face, pigmentation of face. Usually during pregnancy, the mother will develop a chloasma in the face, butterfly, mask-like appearance in the cheek. Then eyes, color of sclera, pupillary reaction and conjunctiva. Mouth, oral cavity for any dental caries, gum bleeding, coated tongue, and angular stomatitis. Head to foot assessment. Check for septal deviation by placing a finger at nape of nose and move downward to tip of the nose. Ears, setting of ears, draw a line from the outer canthus to the upper border of the pinna. Check for any abnormal discharge also. In the neck, inspect for any abnormal growth, palpate for lymph node enlargement and thyroid gland enlargement. And auscultation, auscultate for S1, S2 sound, murmur sound, breath sound, and vowel sounds. Breast inspection. So under the obstetrical examination, we have to concentrate mainly on the breast and abdominal examination. So under the breast, so before we start the procedure, we have to advise the mother to loosen the brassiere and make her to lie in the supine position. Okay. Then the breast has to be covered with the help of a small towel. So breast examination, actually the nurse will be starting on the right side. She has to expose the father's side, which is nothing but the left hand side of the mother. Then you have to do the inspection. So under the breast, you have to inspect for size, shape, symmetry. Pigmentation is primary areola, secondary areola. Montgomery tubercles, which is nothing but a white dot which is present around the areola. Prominent veins, any rashes or scar and dimpling. Inspect the nipple for any inversion and cracking. Next, palpation. So palpation in the breast, palpate clockwise and anti-clockwise for tenderness, any mass and lymph nodes at axillary tail. Then squeeze the nipple to check for any secretion in the third trimester. This is the image of a Montgomery tubercles, which is nothing but a white dot which is present around the areola. Coming on to the abdominal examination. So abdominal examination, we have inspection, palpation and auscultation. First is the inspection. Under inspection, we have main 9 points to inspect. So before we start the inspection, we should ask the mother whether she has emptied her bladder or not. Make her to lie down to keep her legs and thighs in a semi-flexed position, and the nurse will be standing on the right hand side of the woman, as I have told you earlier. Ask the woman to loosen her cloth and expose only the abdominal area. Inspection, you have to check for size, shape, contour, umbilicus, skin changes, bladder, previous surgical scar, flank and visible fetal movements. So in the size, we have 3 interpretations, that is small for gestational age, appropriate for gestational age and large for gestational age. Say for an example like oligohydramnias and IUGR, will be having a mother will be having a small for gestational age. And it will be appropriate when we look into the abdomen without touching the abdomen. By looking, we are supposed to find out all these things. Okay, so by looking into the abdomen, we can able to elicit whether the abdomen is a small for gestational age or large for gestational age. So the conditions like polyhydramnias, multiple pregnancy, pendulous abdomen, transverse lie and all, the size it will look like a large for gestational age. Next is a shape. We have 2 shapes. One is round and ovoid in shape. So ovoid is a normal shape and round in shape in conditions like polyhydramnias, diabetes mellitus, then multiple pregnancy, transverse lie, you will able to elicit a round in shape. Contour, in contour, whether the abdominal muscle is well contracted or relaxed. Umbilicus, dimpled, flat or protruded. Next of the point is the skin changes. Here we have to elicit the linea nigra, stria gravidarum and albicans. Linea nigra, which is nothing but a line which is extended from the symphysis pubis to xiphisternum. It is lightly pigmented from the symphysis pubis to umbilicus and darkly pigmented from umbilicus to the xiphisternum. And stria gravidarum, which is nothing but a dark brown stretch marks, can able to elicit in the lower abdomen and for few mother in the lateral and all over the abdomen also. Stria albicans, which is nothing but it is a silvery stretch marks and it can be elicited after the delivery. Then bladder, already it is emptied. Previous surgical scar. If a mother is a gravida mother and if she has underwent cesarean section in the previous pregnancy, you can able to elicit a surgical scar in the lower abdomen. Apart from this cesarean scar, any other surgical procedure if she has underwent in the abdomen means that also should be mentioned here. Then flank, it will be full towards the labor. At the end, nearing, a mother is nearing for the labor process. And finally, we have to watch for a visible fetal movements. Stand for few seconds, just look into the abdomen and watch for visible fetal movements. If it is present, you say it is a visible fetal movement is present at the time of examination, or else it is not present at the time of examination. So this is the image of a skin changes, linea nigra, stria gravidarum and stria albicans. Coming on to the palpation. So we have a four type of palpation. We have a fundal palpation, lateral palpation. Okay. Then we have a pelvic and fourth manual. So fundal palpation, before we start our palpation, we are supposed to check with the fundal height. So fundal height, there are two methods to find out the fundal height. We will call it as inch tape method and finger breadth method. So before we touch the abdomen of the mother, warm up the hands by rubbing both the hands together and place the ulnar border of the hand at the fundus. So using the ulnar border of the left hand, start palpating from the xiphisternum and gently walk downwards towards the umbilicus to find out the resistance of the uterus. So once you found the resistance of the uterus, place the left hand, and the left hand should not be taken out of the abdomen. Okay, so inch tape method. So in the inch tape method, so from the point where the resistance is found, from that point till the symphysis pubis, the inch tape has to be measured and it has to be represented in the centimeter inch tape. Next method is a finger breadth method. So this is a image of inch tape method. Finger breadth method. So here also the same thing. With the left hand we have found the resistance of the uterus. So we are not supposed to take hand out of abdomen, left hand. Okay. So right hand has to be placed at the level of umbilicus. So till umbilicus it is 24 weeks of gestational age. Then you should calculate each finger, okay, to the previous one, that is 24 weeks. So one finger is equal to 1 week. So add the number of fingers by turning the right hand until you reach the resistance of the uterus. So this is how you are supposed to calculate the gestational age by finger breadth method. Coming on to the palpation. So first is a fundal palpation, which is otherwise called as a first manure. I told you earlier, you are not supposed to take the hand out of the abdomen, that is your left hand, because we have found the resistance. Okay. So both the hands, palpate gently by laying both the hands on the side of the fundus and determine the pole of the uterus. Check whether it is a hard round mass suggestive of fetal head or soft boggy mass suggestive of fetal buttocks. Suppose if there is no hard round mass and soft boggy mass, means if it is empty, means it can be a transverse position. This is the image of the fundal palpation. Coming on to the second maneuver, which is nothing but the lateral palpation, right and left. So move the hands on either side of the uterus at the level of umbilicus and apply the gentle pressure. With the help of the left hand, push the fetus towards the opposite direction. So we are supposed to do the lateral palpation, that is left lateral palpation first. So if you are getting a continuous C-shaped curve, it denotes the spine of the fetus. Then push the fetus towards you. So currently you will be doing a right lateral palpation. So in the right lateral, if you are getting a irregular nodules, means it suggestive of fetal extremities. Always correlate the right lateral with the left lateral palpation. So in case of transverse line, means the head or buttocks will be present on the lateral side. This is the image of the lateral palpation. Third maneuver, which is nothing but the Paulus maneuver, second pelvic rib. So continue to face the woman's head. Instruct her to bend her knees in order to avoid the discomfort during this maneuver. Grasp the portion of the lower abdomen immediately just above the symphysis pubis between the thumb and the middle finger. Give a gentle pressure over the abdomen in order to feel the presenting part, and always correlate the first maneuver with the third maneuver. By holding the presenting part in the right hand, move to confirm whether the presenting part is mobile. So if it is mobile, ballotable is present. If it is not present, the head is engaged, so it is called as not ballotable. This is the image of the third maneuver. Fourth maneuver, which is otherwise called as pelvic palpation, first pelvic rib. So turn the face, the foot end of the mother. Instruct her to bend her knees in order to avoid the discomfort during this maneuver. Keep both palms of hands on the sides of the uterus with the fingers held close together, pointing downwards and inwards. So if the fingers are convergent of both hands, it denotes the head is not engaged. If divergent, means it denotes the head is engaged. So always correlate the second pelvic grip with the first pelvic grip. So this is the image of the pelvic grip 1 and 2. Last one is auscultation. So here FHS can be heard through fetoscope or stethoscope. By placing the fetoscope or the bell of the stethoscope at the spine or the back of the fetus at the midpoint of the spino-umbilical line, which is above the umbilicus if it is a breech presentation and below the umbilicus if it is a vertex presentation. So we can able to count the FHR for 1 minute using a watch with the second hand. Inform the mother of the result and record the findings in the women's recorder. This is the image of auscultation. Inspection. Coming on to the other general genitalia inspection. Mons pubis, hairs and signs of any infection. Labio majora and minora, inspect for any edema, redness, rashes and lesions. Discharge, inspect for presence of any discharge in the vaginal region. In the per-vaginal examination should be performed only when indicated. Perineum to be inspected for any rashes, lesions, scars and edema. Extremities have to be checked for pedal edema and Human sign. Diagnostic test. Laboratory test, that is complete blood count and blood group to determine the blood type and other blood abnormality. Rubella to determine the immunity. Urine analysis to detect infection or renal disease. Protein, glucose and ketones. Pap test to screen for cervical cancer. Chlamydia to detect STD. Glucose to screen for gestational diabetes. Analysis for ova and parasites. Venereal disease test should be performed to screen for syphilis. Hepatitis B surface antigen to detect carrier test or active disease. And the hemoglobin will be repeated at 36th week of gestation and every 4 weeks if HB is less than 9 gram per deciliter. Summary. Antenatal assessment is a systematic and continuous evaluation of a pregnant woman and her fetus throughout the pregnancy. It includes the detailed history taking, physical examination, abdominal examinations, laboratory investigations, and fetal monitoring. The main purpose is to detect the high risk conditions earlier, monitor the fetal growth and well-being. We can able to prevent the complication, as well as we can also able to promote the maternal health. So nurses plays a vital role in assessing the maternal vital signs, weight gain, fundal height, fetal heart rate, and identifying the danger signs such as bleeding, edema, hypertension, reduced fetal movements. So through health education regarding the nutrition, hygiene, immunization, rest, exercise, and birth preparedness is also an essential part of AN care can be given by the nurses. Conclusion: antenatal assessment is essential for ensuring the safe motherhood and healthy fetal outcomes. Yearly registration and regular antenatal visit help in the timely detection and management of complications. For nurses, proper knowledge and skill in AN assessment can able to improve the maternal and neonatal survival and contribute to safe delivery and positive pregnancy outcome. References. Thank you.